And as you can see, we are approaching cure. It's now around 80% of patients who will remain without recurrence long-term. And it's not that in wonderful Austria we have much better treatments than you have, but we have excellent early detection. We cannot prevent breast cancer, but we can detect it early. And why is this important? Because breast cancer everywhere in the world is the most frequently diagnosed cancer in women. And, we are all equal as well in breast cancer death. Now, outcomes have improved overall. So this is like from 6 decades. And I show you what can be done. This is breast cancer survival in my country now. And as you can see, we are approaching cure. It's now around 80% of patients who will remain without recurrence long-term. And it's not that in wonderful Austria we have much better treatments than you have, but we have excellent early detection. We cannot prevent breast cancer, but we can detect it early. We do have population-based screening. Austria is a small country, 9 million, less than Shenzhen, considerably less. But we do use a baseline mammography at age 35 and then have biannual mammograms for this patient as a public healthcare program. Any breast cancer can be cured if we detect it early, while we cannot so far prevent it. I'm showing you an example. You don't have to be an expert to see the breast cancer here. Everybody can see it. Okay, I magnify. It's 1 millimeter. We even did an MRI. Might not be necessary in such a case, a waste of resources. And that's the specimen radiography, and look at the size indicator. So this patient is cured by the surgeon. Being a surgeon, I have to say most patients are cured by the surgeon, but in this case, it's actually easy. No side effect-rich treatments, no tolerability issues, minimal invasive harm to the patient. And by the way, the cost for society is also rather limited in this case. This is when they do not detect early. And I think that makes it very clear that we need to implement programs to find the cancer early. And as our president has said, and we have new tools. I'm hoping that ctDNA that we now use to molecularly classify metastatic breast cancer that is quickly moving into the early setting eventually will be available for screening and early diagnosis. And, to select patient populations who need more intense early detection, we have now artificial intelligence, and we're going to hear, I believe, from Laura Essam and some of her exciting trial results. So with that, I think we need to work together, as you see in this wonderful Hispanic habit of building, with many people, a tower that one at the top can actually look further. Thank you very much, and happy to discuss.